Hi, I'm Dr. Marcus. I'm a pediatric ophthalmologist at Virginia Eye Institute. I've been with the Virginia Eye Institute for about a year. So my specialty is actually pediatric ophthalmology, which involves all eye problems for children and adult strabismus. So I do see adults, but only for eye movement problems, double vision or eye misalignment. I chose pediatric ophthalmology because my husband has strabismus. He has an eye movement disorder, and it was diagnosed when he was a child, and it's something that he's always going to have throughout life. So I have a lot of exposure to somebody with strabismus, and that's a big part of pediatric ophthalmology. I thought it was a great specialty, and I really got to know his family over the years, obviously. It really meant a lot to them, especially when he was a child, being diagnosed and everything. Because for some time they weren't really sure what was wrong with him until they found a pediatric ophthalmologist, and that had a big impact on the whole family. So strabismus is a misalignment of the eyes, and it can be crossing or drifting or vertical misalignment. It can be constant or intermittent, and it happens in both adults and children, usually for different reasons. Sometimes it starts in childhood and extends throughout life. There are different varieties of it. There are different treatments for it. Sometimes glasses are all that's necessary, and that's very common in children. And if glasses are not going to be helpful or only treat part of the problem, there is surgery to correct the problem. For very small amounts of strabismus where the eyes look aligned to the average person, but the patient experiences double vision, we can do prisms to relieve their symptoms and avoid surgery. I actually had a patient recently who had had a stroke several years prior to me seeing him, and had terrible double vision, wasn't able to drive, and at this point he had recovered mostly from the stroke, but his big limitation for driving was the double vision. And just by putting a prism in his glasses, I was able to get him to see single, and so he's going to be able to drive, and that was really nice. I love Virginia Eye Institute because it's really patient-centered. So unlike a big hospital or a big medical center, there aren't a lot of people saying, well, you have to do it like this because that's our policy. At Virginia Eye Institute, it's really about, well, what is right for your patients? And that's really important for pediatric patients, because I have a lot of patients with special needs and kids of all ages, and so I really feel like Virginia Eye Institute really makes it a priority for me to be able to make my patients comfortable and the families comfortable. And so I've been able to make modifications to the exam lanes and the waiting areas and so forth in order to really accommodate my patients and their needs.